What do you recommend for kids prior to getting into a sports program? Every year in high school athletics, parents take their kids to go get a physical before they participate in sports. They check the muscles, they check the bones, they check the heart, but what about the brain? So it's important to get some brain baseline function. And so there are a number of baseline tests that can be done.
Preseason testing is done before every sports season. This is especially important for children as they grow so much over the course of the year. Every baseline test will include different components. These include tests of cognitive or memory, of eye movements, or of balance.
So we do something here at the Mayo Clinic called the timed tandem gait. So we actually get people to walk heel to toe, right? Like they're walking on a tightrope. And we time them over a certain distance. That's what we call a dynamic test of balance. The second thing we do is look at eye movements. The eyes are the window into the brain. Over half of the brain's pathways control eye movements. So it's very hard to have a brain injury and not affect the accuracy of eye movements. We do a test here at the Mayo Clinic called the King-Devic test. It is undoubtedly the single most validated sideline test for concussion.
The King-Devic test is a rapid number naming test that establishes a baseline at their preseason evaluation that can be used for detection of concussion. The goal is just to read them as quickly as you can without making any mistakes. And for kids, this is great. They think it's a game. They like to compete, and they're quite good at it.
Eye movement efficiency is a very sensitive measure of brain function or brain dysfunction. And in the setting of an injury, this test is administered, and it provides an objective sign, an objective number that tells you that this child may have a brain injury.
A baseline performance measure is so important because then we have a snapshot of that athlete's functioning at their normal best performance, something objective. Then if they take a concerning hit on the field, we have something we can pull them off onto the sideline, retest them again, and see if there's been any decrement in their performance. And if there's any change, that's a sign they should be removed from play and evaluated by the medical professional.
The King-Devic test is not only a rapid test, it only takes 2 minutes to complete on the sideline, but it's also very easy to administer. A parent or a safety officer who is trained at administering the King-Devic test tells you that there is something abnormal about the brain function.
These tests are really important to pick up something that might have happened during the season that went unrecognized. And that's why annual baseline testing is really important.